How does the allowed amount affect your coinsurance costs? Imagine going to the doctor and getting a bill. You might wonder how much of that bill you will actually pay out of pocket. Well, the key factor is something called the allowed amount. This is the maximum payment your health insurance plan will approve for a service. It's like a price cap set by your insurer. Your coinsurance is a percentage of that allowed amount. For example, if the allowed amount for a visit is $100 and your coinsurance rate is 20%, you will pay $20 after meeting your deductible. It doesn't matter if the doctor billed more than that. If the provider charges $200 but the allowed amount is only $100, your coinsurance is still based on that $100. If the provider is in network, they agree to accept the allowed amount as full payment. That means you won't owe the difference between their bill and the allowed amount. But if the provider is out of network, the allowed amount might be lower, and you could be responsible for paying the difference. This is called balance billing. So, your total costs could go up if you choose out-of-network providers. Your deductible also plays a role. You usually need to pay your deductible first before coinsurance kicks in. Once you meet it, your coinsurance is calculated as a percentage of the allowed amount for each service. Knowing the allowed amount helps you estimate your costs more accurately. For seniors managing health plans, understanding the allowed amount is important because it helps you plan your healthcare expenses. It encourages choosing in-network providers to avoid extra charges. Reviewing your plan's allowed amounts and coinsurance rates can help you budget better. It can also influence your decisions about when and where to seek care, especially if you are on a fixed income. In short, the allowed amount sets the limit on what your insurer will pay for a service. Your coinsurance is based on that amount, so knowing it helps you understand how much you will pay out of pocket. Being aware of this relationship makes managing healthcare costs easier and more predictable.